Okay, you guys, good morning or good afternoon. It is almost 12:30. Um, I am about to do I have to do some CEUs for my surgical tech and surgical first assist certification. So my first assist certification, let me show y'all real quick, like what I'm doing. Hold on, first I need to share my screen. Share. Actually, we're gonna shut the whole window. Okay. So where are y'all at? Let me see. Maybe can I move this to layout? I want to choose a different layout. I think I have one. Can I choose to remove this? Let me get this one. I don't know if this is right or not. Let me just gonna go with this, y'all. Hold on. Okay, there we go. It wasn't moving. It was like froze. Okay, it's that. I need to there. So I'm gonna go over here. All right. So first of all, I'm on AST website. If you are not a member, you will not get to see this. So you have to make it easy for yourself, just go ahead and come over here. You have to pay. I'm just trying to make sure I don't got too much showing. But you have to pay for this membership. This membership is $80. I think it was $80. I was trying to see. I can't give y'all all my tea. But anyways, you just come over here and you pay. As you can see, I'm not always the member, but in order to do my certifications, I just pay the $80. And once you do that, then you will have this kind of board. If you don't, it'll say join right here. Even if you click on this, you won't get to see this page. So as you can see, this is just the CEU page. This is the page where you can come and look up all the CEUs, but they also tell you on here what you need, how many you need. So for me, I'm on a 2-year cycle right now. I think everybody is on a 2-year cycle. I think it used to be longer. I think it used to be like 4 years. But every 2 years, I have to come in and do this. And so I have to do 38 CEUs, and 8 of them have to be considered live. And my certification day is July. July is in December. So I got about 2 months to get this completed. Also you can't start your member or your CEUs until the year that it expires. So mine expires December 2025 of this year. So I could have started in January, but I can't start for my next. So I have to renew in 2027. I can't actually start preparing or get my CUs until the year 2027. So I'm gonna go ahead and show you guys what I'm doing this time. I'm not gonna before I would go in and like individually pick. I would go in and individually pick, but they have I know I'm going fast. I'm trying to find it though. They have groups of one. So these are the live sessions. So in mine, I just told you I have to have 8 of these. So though I'll come back and do those later. But I did have, I don't know, I just lost it. Hold on, y'all. Let me find it again. Come back. It's closer to the top of the list. You can see over here how long the list is because it's like going down. So I was looking at this one right here. I started this one. So let me show you. They have a PDF that, okay. Let me go back and show y'all what I did. So when you click on the PDF for this one, it takes you to the whole package. So you click on it, and then there's a article for each of these topics. So you have, I think this one said 8 topics. How many is it? Hold on, let me go back. I think it's 8. Where am I? Okay, so 21 CEUs for $35. which is, I need 38, right? So that's good. So we're going to go ahead and go with that. And then once I'm in here, now I can see what they want me to know about. Each of these have one of these articles. You click on the article, it tells you about the topic. You can come over here, read it, find out everything you need. This one was about surgical errors. So I've already taken the exam, but I'll tell you, you need to know about malpractice and breach of duty. So you could just read this and then take the exam, or you can do what I do, because they don't care how many times you take it. So I just take it, and then if I don't get it right, then I don't get it right, and you don't get that check mark. So this is what it looks like. Which of the following risks doubles a man's risk of developing prostate cancer? And you can decide which one. I'm gonna go with 65 and older. And as you enter you see how it just went away. So I can't go back until I'm completely done with the exam. So I'm gonna finish it. I don't know how many questions this one is. Let me see if I make it big, if it'll show me. No. So you just keep going until I guess they feel like you know it, which is not a screening for prostate. So I don't know. So I'm gonna come over here, and it's not time, so you don't have to feel rushed. So I don't know what's the factors of having a prostate cancer, or what's the test. It asks about the test. So let's see the pathology. Let's just scan it and see if it gives us any information. And if it doesn't, then I have to go in. Okay, so it looked like we got a bone scan, a CT. Is that just for that? Hold on. Okay, here they go over here. I'm assuming, because these are the, where is it? Let me try to find here it is. The quiz. Okay. So as you can see, it says, what is not a screening test for prostate cancer? So we see the digital rectal exam is done manually during the physical. So that's one. It says the prostate significant or specific antigen is a way to do it in the blood. So I'm assuming it's going to be EPT, but I don't, let me keep scrolling down here, y'all. I don't see EPT on here. Or did I? Don't look like EPT is on here. Okay. So it also gives you like the suture, the blades, and everything to do this procedure. I don't see the test. So I'm just kind of reading over it. I don't really know too much about prostate cancer. So we see here they have a laparoscopic view of how they would do it, how they would do a prostatectomy. This one's saying using the Da Vinci system. So, oh yeah, I guess I could see that because of the arms. But that doesn't mean that, because those look like regular instruments, like laparoscopic instruments to me. So anyways, I'm going to go ahead and go with my answer. I'm going to go ahead and go with, what did I say? EPT? None are, so we know this one not right. So I'm going to go with EPT. We know that one's not right because the other two was. So it says, which is preventable risk? We're going to go with diet. It's always diet. Which is mismatch? So let's go back up here because I saw that up here. Now you can just read through this whole thing, and if that makes you feel like you know the information, then go ahead and do that. But I'm not going to spend that much time doing it. I'm going to just kind of read over it and go from there. Let's see. So it says, hold on, I need to make this. Let's put this over here. I need to move you out of the way. Let's put it over there. So low grade, some 2. So is it metastasized? Low grade 3. I think they got because here it says if it's 2 or lower grade tumor, 5 or 6 is intermediate. Okay, so then we know 9 is high grade tumor. We know 6 is not right because they're saying less aggressive. 3, I would say is right. That's right, a low grade because we got 2 to 4 is low grade. And what is 5? So which one is mismatch? I'm going to go with 6. It's least aggressive. That's not true. All right. And which one is metastasized? Stage A, localized stage B. So let's find the tumor because this is grading. So I thought I seen a tumor down here, right? Oh, here's the chart. Let's see. Tumor B. Wait, where's A? Okay, staging. So here we are, staging. And then A, the tumor is localized and usually found during the procedure unrelated to cancer. Tumor is localized but found by the, what we said this was? The DRE. I think that was the digital. I can't remember what that word was. It's up there. All right, let's check it out. So we got stage A is localized. That's right. B2, it says cancer is limited to one side of the prostate. But right here it says in stage B, B2, cancer is on both sides. And then C says that the tumor has spread. And D says that it's in the bones, lymph nodes, and you can kind of see that right there. So we're going to go with B, the cancer is on one side, because that's not true. It's on both sides. Cancer is limited to one side. I don't know why it's not going away. It's like froze because it should just disappear, right? If I redo it, it's gonna reset me. So I'm not. I had to redo it, y'all. Okay, so let's start over. Actually, I'm gonna pause y'all and catch up. Hold on. So we back. It didn't take me that long to catch up. So where did I put the? Okay. I know y'all want me to read these, but I'm always gonna go with all of the above. I can tell you that right now. All right, how many ports is needed for robotic? I think we saw 4. Let's go back up here. I'm pretty sure I saw 4. Where is it? Oh, it's down. I see, yeah, I see. Oh, I see 5 ports. I see 1, 2, 3, 4, 5. Let's go with that. That's not an option. Besides you. So 5 is not an option. How many did we see? I see 5. 1, 2, 3, 4, 5. How many do we need? I want to say 4, but let's see what they say. 3 ports are needed for the Da Vinci. Which one is it? Did they specify? Yeah, it said 3 ports. I see 3 on there. The 3 ports are needed for the Da Vinci surgical system, to 2 assistive ports and a port in the umbilicus. So how many do you need? So 3, 2, 1. That's it. All right. Cautery should not be used near the. I'm gonna say the fascia of. I already say this wrong. wrong. So Zucker, whatever. I might be wrong, but let's just make sure. Let's see if it has anything about Cartery. Conclusion, GBT, hematomas. Those are the complications. Endo catch to take you out, right? Passes through the port, places that. Okay. How? I don't see it, y'all. Let me just read the question again. Cartery. It must be in the procedure. Hold on. I might be wrong, y'all, because I definitely don't see nothing on here. I don't see anything about Cartery on here at all, but I think that's right. I'm gonna just go with my. It's not down there. It should be in the operative procedure. Abdominal shave. Yeah, let me read these. Scrub, 3 ports, umbilical, camera, neck, umbilicus. It don't say when you get in. Oh, maybe that's it. Epigastric care should be taken to avoid injury to the inferior epigastric vessels. They don't say nothing about Cartery though. Maybe that's what it is. I think if they ask something about Carter, they should specify, but can I find? Can I search? Maybe not. Oh, here we go. Should not be used near the neurovascular bundles, as thermal damage to the neurovascular bundles may cause impotence or incontinence. Now we know. I definitely didn't know. The robotic surgery, the patient will be hospitalized approximately with robotic surgery. I'm going to say 24 hours, but let's go. We should be down here in post, right? Conclusion. Oh, yeah. The patient will normally go home within 24 hours, excluding any complications without any restrictions. Yeah, that's the whole point of it being robotic, is so it's not so invasive, and the recovery time is limited. So you can see we needed a 70. I got number 1, number 8 wrong. I do not know what numbers those are or what. I could go back and show you, but let me. If I do that, let me see if it'll. What is it? I'm gonna see what number, because I don't think they changed. Well, it's not letting me take it again. So, anyways, we passed it. You see, it's a check mark. So I'll do these. And here's the thing: once I'm complete with all of these, then this box will light up, and then I can check out. So this is going to be $35 for me to complete this. So overall, what y'all let me bring y'all back on. All right, I'm not sharing no more, right? Okay. So overall, I had to pay $80 to even be to get accepted into the membership. And once you pay the $80 to join the AST membership, then you can actually go in and do the exam and do the CEUs. So you see, I'm doing the package. So I use the package because it's $35. And so far, I paid, what is that? $115 just to do the CEUs. Now I can write these off, so I ain't really worried about it, but I don't want to spend a whole bunch of time doing it. So I'll come back probably later on today, do a few more of them, and once I get done with this one, I might wait and then, well, let's see what I could do next. So I'm gonna bring the screen back up. We just gonna look together to see what other package I may or may not want to purchase. So let's go back. And I know I'm gonna remember this one. And you can just let's see what it's labeled as. Oh, it's just package one. So I can do another. I need what is it, 38? So I'm not gonna do probably, maybe I'll do another. So that's 21. But remember, I gotta do the live ones, right? So none of these are live. These don't look like none of these are live. So, oh, it looked like I must have did this one the last time. Once I finished, I don't know if I must have. They keep a history for you. So you could come down here and look. I need 8, I think it said, of the live classes. Let's look again. I think it said 8. Yeah, including 8 as live. So if we're doing 21, I still need 8 of the 38. So 21, that's 9, that's 29. So I'm still gonna be about 6. Is that right? What did I say? 38, 29. I think that's like 8. 31, 2, 3, 4, 5, 6, 7, 8, 9. I'm 9 short. Yeah. Because what am I doing? Yeah, I'm 9 short. I did count my fingers. I don't care. Yeah. So I'll still be 9 short. So I could still pick another bundle. I could pick a bundle. Or you see how, like, if I don't want to pick a bundle, I could pick like these. If I wanted to come in, and you could come in and pick, if you're working in a specific field, excuse me, then come in here and pick one of those. I think I'm gonna just do cardiovascular. I might do some cardiovascular stuff, but I need a bundle of at least 9. Oh, sorry. Hold on. Oh, they got it. So preceptor, I could do, that's 5, or I could do this one. Let's see what this is. Hold on, I'm just looking, y'all. Okay. So if I could do the 7, this one, because it's only $12, right, for a 7. And then I could kind of play with the other stuff. So let's see what this is. I could do the 9.5. I mean, I don't really want to go over. What is this one? MRSA, bed bugs. Let's see how fast this is. We just gonna try it, y'all. We're gonna go A and B. This strain of MRSA. I don't know. I'm gonna just go with MRSA. All of the above. Has with HA MRSA, the infection spread with colonized colonized individual comes into contact with the patient has had blank or blank. Open wound or infection. I'm gonna go with it. Which is not a common sign of skin, infection. Bruising. Oh wait, if the test returns positive for MRSA, the bacteria has been proven resistant to, oh, I was going to say amoxicillin and penicillin, but I'm going to go with that. I don't know. Oh, yeah, we're going to go with that. It's widespread since. Ooh, what we going to go with? The 70s? I'm going to say that. MRSA colonized in the nose and the skin around blank of the population. Let's make it not so bad. MRSA thrives and colonized MRSA thrives on colonization primarily through the, I'm gonna say anterior hands. Let's go with hands. I didn't mean to hit that last one, so I got all around. All right. So maybe you don't know as much as you think you know. You know what I'm saying? So we can come in here and check us out real quick. Let's do it quick. Is this a long article? Do I want to read? I know most of the questions now. So in the 50s, it started being spread. Adapted new strains, resistance, old and new. This one ain't that long. Okay. Oh, had surgeries. So the HA MRSA infection is spread when the colonization of individuals come into contact with a person who has had surgery or a weakened immune system. Ew, that looks gross. I want to bust that abscess. Oh, this looks bad. On the hand caused by MRSA. Ooh, and look, they put a thing to see how it spread. The prevention of MRSA, skin infections, exposed, monitoring, actions, hospitals, hygiene, hand hygiene. All right, let's try it again. Oh, I need to open it. Which one I was on? This one. You could just pick the ones too that you think. I think I got that first one wrong. Active. I'm gonna still go with both hands. Is the most effective. Which strand is? I think it was that one. I'm gonna go with this. Oh, I know it's surgery and weakened immune system now. It's not common, bruising. I don't know if I got this one right. Normally, if it's one penicillin, it's both of them, right? We saw that it was in the 50s. I'm going to go with 45 this time. Maybe we don't just guess. Hold on. Where is the... What was the question? Oh, the percentage. It must be up in here because 50%. Oh, no, that's hand washing. Oh, look, I got it wrong. It's sulfoxetine. However you said it. Nah, no. If I need to come back in, do it again. Personal, you get nastiness. Don't be sharing personal care items. That's what it's saying. Which you already know that. So I don't see how many. Oh, they ain't giving a number. Like they probably are. I'm just like because I'm not reading it. I'm just scanning it, y'all. Like, and it probably would, if you want to sit down and read it, it might make you feel better. So it's not like you feel like you wasted time. I know a lot of people be like, oh, you could have just read the whole thing. As many times you're going to take it, and you might be right. I don't know what that one is, y'all. So we just going to keep going. I'm going to go at 45. MRSA thrives on colonization primarily through, I want to say, hand washing, anterior nasal regions. Let's try that. MRSA thrives on colonization. Well, I know they swab your nose. It's not froze up again. Let's go with hands then. I don't know why it's doing it, y'all. Hold on. Let's go fast. I'm going to just go with what I already had picked. Because it's only 9 questions, I think, or 10. Which just kind of just gave me a chance to fix that question. We're going 45. And I said we're going to do anterior nasal. All of the above. We passed it. I got 2 and 8 wrong. I don't know what 2 and 8 was, but boom. Oh, shit. Y'all supposed to submit that. Hold on. Oh, boo-hoo-boo. I was supposed to submit that. Did y'all see that at the bottom? Hold on, I'm going to show you. It won't take long because now I know the answer. I wish I got 2 wrong, so we're going to go with this one this time. And then we're going to go all of this above. It said I got 2 and 8 wrong, so I'm going to get 8. Let's see what 8 is. Okay, so let's go with 20. I think I did 25 one time. We'll go 25. And what did I pick? Anterior nasal region and all of the above. Oh, I got them all right that time, y'all. So boom, that was right. Let's submit it. So that was done. So I'll probably finish these 2 and then I'll take a break. I don't know if I'm going to keep y'all on with me. Just why not? Like, we're going to open this up because at this point, I'm aware that I don't know. It's okay. It's okay, y'all. It's okay to not know. All right, let's go for it. According to the CDC and the hold on, let me open up the close this out. My email. Let's hide you because you're doing too much. And now we can open it. Oh, it won't do that. Okay. So according to the CDC, 1 in I put this thing for y'all. 1 in blank acute care facilities put at least 1 hospital acquired. I'm gonna go with 25. Which group of hospital-borne pathogens is known for invading through hospital equipment, surgical implants, and central lines? Ooh. Y'all know I want to put MRSA, the best ways to combat. Okay, we're going to go with CRE, the superbug. That's what I'm seeing them talk about right now. Let's do that. You know, go CRE. All right, so we're talking about hand washing pretty much. This has increased how much in the past? Definitely didn't just see that. Okay. Increased from 2% to 10% through the past decade. So we got 10 here. These superbugs have the ability to share its blank with others bacteria, making it far more common for bacteria. I'm going to go existent strands. I'm going all of the above. In the state of Florida, the CDC worked to help stop a year-long CRE outbreak. After a year, the percentage of the patients who got CRE in the facility was at least what the percentage of the patient who got what if I go 44%? Tuberculosis is one of the most was once a curable disease. Now, much like others in the superbug, is resistant to antibiotics. How many people does TB kill every year? Oh, I have no clue. I didn't know TB was resistant like that. I don't see TB. I wonder why I can't find. That wasn't what I wanted to do, guys. Sorry. Oh, that's the end of it? Okay. That's not too bad. So, how many people died from tuberculosis? That's what I'm looking for. That's hand washing. Is it up here? Yeah, here we go. Oh my God, tuberculosis is spread faster than ever and is difficult to treat, according to the World Health Organization. In 2010, 650,000 out of 12 million TB were resistant. That's crazy. 12 million. Well, it didn't say they killed them. Does that mean they died? We're going to go at 12 million. Or it says in 2006. So how many people did TB kill? Does TB kill each year? They don't say that. Oh, here we go. This condition is tuberculosis was once curable with antibiotics, but much like others, in the superbug family, it is now resistant to antibiotics. This condition is global, killing 1.34 million people. That's crazy. I think also this has a lot to do with people using too many antibiotics. Which of the following is a type of foodborne superbug? I'm gonna go with Salmonella, chlamydia. That's funny. I just seen 1950 up there, so I'm gonna use that. CDC reports that blank states in the United States have had at least. I'm gonna go with 49. I got that one wrong. Okay, I might need a break, but I'm gonna finish this one and then I take a break. I got a lot of them wrong, y'all. I got half of them wrong. That's crazy. Let's try it again. Where's my page? Okay. So what it seems like, we're going to start on this page because the test follows this is in the beginning. So if we're in the beginning of the exam, that answer should be right up in here somewhere. It seemed like it. Oh, wait, the history of the superbug. Okay, we don't need that. According to the CDC, one in blank acute care facilities reported at least one. Okay. At least one, in 42 states? I don't see that. Is germ this fact that makes these infections almost untreatable in the last year? 25. Let's go with that. And then we said we was going to do central lines. I'm going to go with that. I think we saw 10%. Or was it 12? I think we saw 10. The superbug ability to share resistance strain with resistance genes. I'm going to go with that. I'm going to go with all of the above. 44% and work to help stop. After 1 year, the percentage of was after 1 year, Mm-hmm. That's hygiene. Everything up here. So, oh, okay. Worked in Florida to stop it 1 year. This outbreak took long term to improve it. 44 from 44 to 0. Y'all see that? What after 1 year the percentage was at 0. And then I know this one because we read it, and this one is from food, and we saw that, and I think I guessed this one. So 42, I see it right here. I passed it, so we gonna go with that. I got 2, 3, and 9 wrong, but we gonna take that. And then I'm gonna do one more, and we're gonna be done. Oof. So, oh my God, this one's a little bit longer. Let's see where it's at. What animal was involved in identifying the outbreak of, what was it, filovirus? Let me pull up which animal, which I think it is, a monkey. Let's close this one. They're always doing stuff on monkeys and rats. Yeah, monkeys. Right here. The strand of Marburg fever was coined probably in West Africa because I just seen them on there too. Oh, it was actually in Germany. The second one was in Zimbabwe. First outbreak of Ebola was identified in the region of, it just says Zimbabwe. Oh, Zaire, the region of Zaire. I wonder if I could split my screen, if it'll work. Sometimes it'll work and sometimes it won't if I do that. Hold on, y'all. I can close that. Yeah. Let's see. I think I lost my spot. Where was I? Zaire. Okay, so we're here somewhere. Oh, 318. What is it? The first reported outbreak of Ebola was in 1970 when 318 people became sick. The mortality rate is 88%. Number 7 are similar to what, the flu? Oh, symptoms. What is it saying? Hold on, y'all. I don't see it. Sinus infection. Oh, leading the infection. Wait. I don't see what they're saying is the I want to say the flu, but I could be wrong. Look how he suited and booted. I don't see the I'm about to say the flu. I don't see that. It's here, I'm sure. What I'm not gonna do is spend a whole bunch of time. Okay, we're gonna go with the flu. All of the above. In the early stages, EVD symptoms. I just seen EVD, but oh, I see EPV. Maybe it's down here. They're talking about the PPE, but the early stages. Okay, here we go. But it skips. So let me come back up here. The symptoms are, wait, I'm still looking at E. I'm getting them backwards. It's EP. I need to be EVD. This is just about, okay. Okay, EVD. Symptoms may include bleeding. Bleeding from well. Ooh. It just say bleeding. Many symptoms include, but it ain't saying where is the bleeding coming from? Ebola virus. I'm gonna say bleeding. Died from Ebola in 2014. How many healthcare workers? 232. Oh, we still going. Based on the recent events in the U.S., the risk of exposure to Ebola virus is what? Is it high or moderate? We still going. This must be a pretty long session. And I think I don't went past where, based on the U.S., the events in the U.S., the risk of Ebola is. It says, based on recent experience in the U.S., it appears the risk of exposure is very low, extremely low. The first reported case was in which city? I'm surprised they ain't put Florida on there. Dallas. I see Dallas right here. Yeah. How many nurses? I just seen that. The 50? No. Yeah. How many Dallas based? Oh, Dallas based. Two. The first identified outbreak was when with was in 19. That's not right. Hold on now. I was thinking 2014, but that's not right. Um, I wonder if it's down here. I haven't seen anything with those numbers, so I can't even make a good guess. This one's longer. Okay, so we're up here. This is where's the virus? That was at the top. I'm gonna go 1966. So that's what I keep saying in my head. Which of the following is not considered PPE? Coveralls? What the fuck? Oh, sorry, y'all. According to the author, the first pair of gloves should be done prior to the gown. Wait. Double gloves. Okay. So put on first. I don't know, y'all. But I want to say prior to, according to the first pair of gloves, should be before the gown. I feel like I'm put before the gown. Prior to the gown. I'm gonna go with it. Double gloving. If disposable blank should be worn. I don't know. Hood. Yeah. 4. I just saw that one. Definitely. Outside of the in the interior room, outside in the hallway, in the interior room. It's a Duffing. Oh, here you go, right here. Wait, potato gear that's not needed for this. What are you supposed to do? What are you supposed to do with it? Double gloving for all patients. But what are you supposed to do? Like coveralls? I don't know. Not this, not this. I'm gonna go with this. Currently, there are how many strands? I don't know how many strands there are. I'm not really sure, y'all. Let's go with 4. That sounds safe. Shoe covers should never be removed by pulling them towards the toe and discarding. What? Shoe covers should never be removed. Sorry, y'all. Where's the shoe covers? I'm not sure. I thought I just saw shoe covers somewhere earlier. It says, I'm just say to avoid contaminating shoes. To remove in a glove, we're going to use our index finger. index finger, ungloved. I think that's right. I thought we just said monkeys. It's not monkeys. It's gonna be. We're gonna go with bats. If it's dogs, I'm flip coveralls with separate. I just seen some with coveralls in it. This one long. I might have to do this. I might have to take a break and come back and do this one. Hoods and waterproof shoe coverings must be worn. What? I think I'm at the end, right? Yeah. So, oh, is these the answers? Oh no, this is so you can do it like at home. Okay. I was like, wait, what? Let me find out. I don't know, y'all. We're gonna go with a separate with coveralls with separate hoods. And if that demonstrates something. Ooh. Generally, in fact, that patients demonstrate symptoms between how many days? That should be up here somewhere. Like, I don't know. Let's go with, because we think we're going to go with something like that. We're going to go with that again. Yeah, this is crazy. How long is this thing? All of the above. Mortality. Oh, I just seen it, y'all. It's 104. I got that wrong. This one's long. I mean, it's not super long, but it's definitely not. Oh, I should have read this. This probably got where the shoe thing is. Yeah, Dawn waterproof booties. I don't know how many people dying from this. It says 8 to 12 days. I think I got that right. For 21 days. 50%. Wait. With the 50%, it says range from 25 to 90. Jeez, the current epidemic involving blank is the most how you say that, virulent? Oh, that's right here on the page. So what's the question? The most current epidemic involving? Yeah, it's this one. The Z. I think we did this. How many early in October? We did this one 200. Wait, let me not guess. This one too long for me to even want to do again. I think I said 232 earlier. October and West Africa. How many people? I thought I was saying 200. I'm gonna go with this because I think that's what I saying. When test with the what when testing for EBD, leukopenia. I'm gonna say so now. I'm gonna go with this one. Require hemodialysis, probably. Y'all, damn. I probably missed about like one question. Woo, that's a lot. All right, we're gonna take a break. That was too many questions. I think that was like 30-some questions, y'all. Where y'all at? I'm gonna make y'all big again. Remove this. Y'all look small, I guess, because I did the thing. But anyways, we're done. That's an hour of seeing you work. I've been sitting here for a long time. I actually did something else earlier that required me to be at this desk, so I'm kind of ready to go. It's 1:30. I'm probably gonna get me a little snackety snack and come back and just relax. It's a little gloomy outside, so I'm gonna enjoy the day. I hope this was helpful. I don't know. I'm gonna put this on my regular Kiafa channel, but I think this is also gonna go on my surgical tech career channel. So maybe y'all will see the clip. Oh my god, y'all. Sorry, I gotta go. See y'all next one. Bye.